Greetings and welcome everybody to the 2022 Virtual Partnership Meeting Series. My name is Terrence Moore and I'm the CEO at MCHB. It is my pleasure to welcome you today for the first session in our series of virtual partnership meetings, jointly hosted by MCHB and the Maternal and Child Health Bureau. These virtual meetings take the place of an in-person meeting that we held each year in the fall. Our virtual meeting series objectives are to afford you the same opportunities for learning, peer-to-peer sharing, and discussion as you would have had in person across the entire meeting series. The overall theme of the meeting series is addressing systems challenges to advance health equity in MCH. We'll emphasize fostering trust between states and jurisdictions and community organizations among jurisdictions and with government entities, sharing effective practices and strategies, building community partnerships, and incorporating families, youth, and young adult voices. So without further ado, I want to pass the baton to my colleague, Dr. Michael Warren at HRSA.
Thank you so much, Terrence. Good afternoon, everyone, or good morning, depending on where you're joining from. Really excited to be with you all for this year's partnership meeting kickoff. I know last year we certainly said that we hope the next time we gathered we would be in person. Clearly we are not quite there yet, and we miss seeing all of our Title V and MCH colleagues from across the country. And we look forward to a time when we can gather again safely together in person. Nonetheless, we are here. We're glad you're here. And we really appreciate the partnership with MCHB in moving this meeting forward. On the next slide, I just wanted to remind folks, last year at the MCHB conference, we debuted the Maternal and Child Health Bureau Strategic Plan. Our mission remains the same: to improve the health and well-being of America's mothers, children, and families. And our vision is an America where all mothers, children, and families thrive and reach their full potential. That strategic plan has 4 key goals: access, equity, capacity, and impact. And it's a plan that will really guide our work for the next 10 to 15 years as a Bureau. Just to give you a sense of where we are now in terms of this work, we are working with a contractor on the best ways to implement this plan. And so specifically, we're developing strategies, activities, and eventually measures to allow us to assess our reach and the work that we're doing on those 4 goals. The strategies will be general approaches. There will be a relatively small number of those. They will cross-cut the goals. And for each of those strategies, there will be specific activities. So the very concrete actions we want to do, the who, the what, the when, the where, that kind of thing, that will help us accomplish these goals. And then measures will help us monitor our progress. We've got 4 strategy teams across the Bureau, each lined up with one of these goals. And so over the course of the year, that is going to be happening for us to move us into implementation phase. I do want to call out on the next slide that one of the 4 key goals is around equity, achieving health equity for MCH populations. We heard loud and clear when we were talking to stakeholders across the country, including many of you, that this had to be a focus area for us. And so it is, in fact, one of the 4 key goals. And we've got objectives associated with this goal: advancing equity in our programmatic work, strengthening our own organizational diversity, using our resources to improve the health of people experiencing inequities and injustice, and collecting and analyzing data to measure and reduce disparities. I just wanted to give you a taste of some of the work we're doing internally in the Bureau. We last year had a consultant on detail for us from another part of HRSA who helped us to develop an organizational framework as we think about advancing our equity work. We're thinking about our people, our organization, and our partners. And just some examples of the kinds of work that we are doing within those various groups. I mentioned we had someone come in on detail for us. We've now had that person join our staff permanently as our senior advisor for equity, the first in the Maternal and Child Health Bureau, but also the first in any of the HRSA bureaus. She is helping to lead much of this work, helping us to think about our focus on equity. We've also got a staff-led work group called the Building the We in MCHB. The We stands for Workplace Equity. they are doing a number of things. They are hosting regular learning sessions for staff all across the Bureau on a range of topics. So, for example, a session during National Hispanic Heritage Month, topics around LGBTQ plus and reproductive health, to think about how we build the capacity of staff across the Bureau to incorporate this work into our programming. They regularly provide feedback to our deputy, Laura Kavanaugh, and myself on how we can guide the work of the Bureau and advance equity. And currently, we're conducting a survey across MCHB, which we've adapted from the Annie E. Casey Foundation's Race Matters survey, that will help us better understand the capacity of individuals and of our organization to be able to advance racial equity and to understand what the developmental needs are of our team and how we might address those. We've also been thinking from the programmatic side about how we advance this work and how we support our partners to do this. You may have seen that recently we've released infant health equity catalyst grants to be able to support partners across the country and provide funding to be able to close the gap and specifically to address social and structural determinants that are influencing adverse birth outcomes. We also have released in the last year supplements to Healthy Start grantees to think about doulas, given the positive impact that we know that doulas have on perinatal outcomes. So we continue to try to look at ways to engage partners and our programming to move this work forward. On the next slide, I just want to highlight one example that I think is really exciting. We've heard from states, both during the needs assessment process and through various interactions with you, that equity is also an important focus area for many of you. So in the 2020 needs assessments, 27 states or jurisdictions listed equity or addressing health disparities as a priority, and 54 out of the 59 states and jurisdictions acknowledged that health equity or social determinants of health, or both, were important considerations in their application and annual report and as the framework for their needs assessments. We've also heard and know that states are in different places when it comes to this work. And so we want to think about the variation in capacity and resources, the different micro-political climates that all of you are in, and think about how we meet you where you are. We remain committed to that. I'm reminded of back when the Affordable Care Act passed, the Bureau stood up technical support, and I was in a state that at the time was not expanding Medicaid, and I remember thinking, how is this going to help me? But the National Workforce Development Center that was providing that technical assistance came in and said, what are the opportunities where you are? As a Title V director and as an MCH team, what resources can you bring to bear, and what change can you make within your sphere of influence? And that was incredibly helpful. So we're excited to think about how we support states along this equity journey in a similar fashion. Our partners at the National MCH Workforce Development Center have just announced a brand new Accelerating Equity Learning Community. The center will bring together 6 Title V state teams starting in April, and that will run through August of this year. Those teams will plan, navigate, implement, evaluate, or sustain incorporating and integrating equity into planning and programs. Primarily, this will be done virtually. There will be opportunities for peer-to-peer learning and sessions where folks get to explore tools that will help them advance this work. And regardless of where they are and what the climate is like, looking for opportunities to advance equity. The application period will open on February 1st. You'll have a month to apply. Those applications are due March 1st. And more information is already on the website for the National MCH Workforce Development Center. So I encourage you to check out that resource. Next slide, please. Look forward to learning today. So excited about the agenda and thinking about the opportunity for systems change, for moving upstream as we try to address some of those social and structural determinants of health that we know are important influencers of inequities. We look forward to learning with you and from you, and I want to thank again our partners at MCHB for their incredible partnership in helping to move this work forward. And with that, I will pass it off to Dr. Stacy Tuck.
Thank you, Dr. Warren, for the warm welcome. My name is Stacy Tuck, and I am MCHB's Director of Programs. I joined the team back in July, and for those of you who have a history of working with Carolyn Stanfill, don't worry, she's still here. I have the pleasure of working with her every day. She is our Chief Strategy and Program Officer now. Before we begin and jump into this packed agenda we have, I'd like to go over a few housekeeping items with you, please. We would like to ask everyone to please change your name in the Zoom settings for us so that will help us with networking, and especially during the breakout sessions. So there are directions on the screen as to how you can rename yourself. We'd like for you to please put your name, the state that you're from, and the pronouns that you choose to go by, please. And as you're doing that, please listen to the next housekeeping items that we have for you. Please, please, please keep yourself muted if you are not being featured and presenting information or asking or answering a question. Please do. I'm guilty of that several times, so I feel like I can warn people not to do that. Given the size of our meeting today, we do welcome you to keep your cameras off during these plenary sessions. But as we move into our concurrent breakout sessions later on in the day, we'd like for you to consider please turning your cameras on just for making better connections and networks and helping to foster better communication. When in the larger group, if you ask a question, we would also like to ask you to please identify yourself. We do want you to know that we are recording the first and last portions of this meeting. However, in an attempt to protect folks' privacy because of some of the sensitive conversation that we will be having, we won't be recording any discussions or commentary that will happen during the sessions. Another thing that we would like to remind you to do, please, is to complete the evaluation link following the session. You will actually automatically be directed to that at the end of the meeting, and you'll also get an email to complete the evaluation. That's really important that you get your feedback. We do also want to let everyone know that closed captioning is available for this meeting whenever we're in the main Zoom room, and you can control this in your Zoom settings bar. We also have provided a link in the chat so that you can access captions externally as well for your convenience. So that's basically all of the housekeeping. I am so excited to welcome you to the next phase of today's presentation and welcome our speakers. To esteemed AmChippers, Anna Corona, who is the Senior Program Manager for Child and Adolescent Health, and Jessica Simon, a Program Manager for Health Systems Transformation here at AmChip. Take it away, ladies.
Thank you, Stacy, and hello, everyone. It's a pleasure to be here with you all today. I am Anna Corona, and I'm the Senior Program Manager for Child and Adolescent Health, as Stacy mentioned, and I'm here with Jess, who I'll give her a chance to say hello before we get started.
Everyone, it's great to be here with you today. I'm Jess Simon, a Program Manager on the Health Systems Transformation team at AmChip.
All right, so on the next slide, just a reminder of what you already know, that the theme of this year's partnership meeting is addressing systems challenges to advance equity in MCH. So Jess and I were asked to share a bit about a practical framework that could be useful for you and your teams and your partners as you continue to think strategically about what kinds of systems level changes you can make to advance equity through your work. So for the next 25 minutes, Jess and I are going to share a broad level overview of that framework I just mentioned, and then we'll wrap up with walking through an example of how you might use this tool using AmChip's internal equity work as an example. The framework that we're going to share with you all here today is called the Water of Systems Change, which was developed by an organization called FSG, which some of you might know as the folks behind the collective impact approach. Now, while Jess and I really like this particular tool for systems thinking, we know that this is just one of many that are out there. We're not saying that this is the only one that you can use, but again, we've had some success in using it. So that's the one that we're going to talk about today. And a quick disclaimer to my Region 5 crew. This presentation might look familiar. It's a version of the presentation that we gave to you during your Infant Mortality Summit last November. We hope it'll serve as a helpful refresher, and we hope you'll stay tuned because, as I mentioned before, we're going to be walking through an example using AmChip's internal equity work. before we get started on that framework, I want to ask you all, what comes to mind when you read the term systems change? And I invite you to interact with us. Let us know in the chat. Feel free to use an emoji to describe what comes to mind when you see or hear the word systems change. You can use a word or two or a couple of sentences, whatever you feel like expressing today in the chat. And while you're responding to that prompt, I did want to mention that there is a longer article that FSG published about their water systems change article or framework, and we're going to share that with you all in follow-up to this session. If this framework piques your interest as we go through it and you'd like to try it out with your teams, I really encourage you to read the full article. It's about 12 or 13 pages and gives a lot of really helpful in-depth details about the framework, some really nice examples to go along with the explanation of the framework, and some other key considerations to think about as you use the tool. So with that out of the way, Jess, do we have any thoughts in the chat about what comes to mind when folks hear or read systems change?
Yeah, tons of thoughts. Thank you, and keep them coming. People are talking about it being challenging, but exciting, daunting, we're hearing, but impactful, the ripple effect that systems change can have. And I think John Richards called it the big work that we aspire to, which I liked.
Yeah, that's great. Thank you everyone for your engagement and sharing that with Jess and I, and thank you Jess for reflecting that back. So on the next slide, what you'll see is the definition that the authors of the Water Systems Change framework decided to use for systems change. And the definition is that systems change is about shifting the conditions that are holding the problem in place. And I watched a webinar about this framework last year, and one of the authors was speaking. His name is John Kenya, and he shared how he and his team spent a lot of time looking up definitions of systems change and reading through hundreds of them. And they ultimately landed on this one from the social innovation generation because it was the most activating definition. And I really appreciated that rationale as to why they chose this definition, because it's very action oriented. So I invite you to keep this definition in mind as we walk through the framework. And in a moment, I'm going to pass it over to Jess to start diving into the 6 conditions of systems change as outlined by this framework. But before we do that, I wanted to launch a quick poll here, just to get a sense of how familiar folks might be with this framework. And the question that you should see on your screen shortly is, which of the following is not one of the 6 conditions of systems change? And so the answer choices are there. Select which one you don't think is a condition of systems change. And we'll just give maybe 10 more seconds there. I see lots of folks answering. I appreciate the participation. It looks like it's close between mental models and education, and then we have power dynamics there in a close third. We'll end the poll now for the sake of time so we can keep moving, but the correct answer is education. Education is not one of the 6 conditions of systems change. But with that, I'll go ahead and turn it over to Jess to get us into those 6 conditions.
Thanks, Anna, and thanks everyone for testing your knowledge with a little bit of a pretest before we give you the answers here. So if we can go to the next slide, meet your framework. This is the inverted triangle framework, which is a model to create systems change. Often when we think about systems change, we're thinking about the structural changes we can make, but focusing our efforts there alone is not sufficient for the large scale changes we want to see. It's important to deepen our efforts towards influencing elements in these next 2 levels, relationships, power dynamics, and mental models, to truly bring about the transformative change we want to see. These elements at the bottom of the pyramid are the least explicit but most powerful conditions for change. As I briefly walk through the 6 conditions of systems change, think about how each of these might apply to your work, and feel free to chat in your ideas as we go. So policies are probably the most self-explanatory. These are the rules, regulations, and priorities, both formal and informal, that designate how you do your work internally and out in the world. Next slide. Practices are your organizational activities targeted to addressing and making progress. Practices could also be an informal shared understanding of how things have been done in the past that then guide your internal practices and continue to influence your work. Next one, thanks. Resource flows. Here we're thinking about how money, people, knowledge, and information even are allocated and then distributed. While this is a really important condition for systems change, it's still at the structural level because resource reallocation alone will not make the long-term transformational change necessary to truly advance equity. Next. Now we're moving down a level to the semi-explicit conditions. Relationships is speaking to the quality of connections and communication among people in the system, especially those with different histories and viewpoints. Next slide. With power dynamics, we're talking about which individuals and organizations hold decision-making power, authority, and influence. This is a system of a condition of systems change, even though not maybe everyone knew that right off the bat, but it really allows us to reflect on who makes the decisions, why that's the case, and then maybe opening ourselves up to realigning and sharing power. Next slide. And then at the root of everything, we have our mental models. These are deeply held beliefs and assumptions that influence how we think, what we do, and how we show up and move through the world. Mental models are the bottom of the foundation because it's the root for everything else. It's our ingrained way of thinking. Mental models influence everything we just talked about, how and why we choose policies or practices, how we make resource decisions, which relationships we are comfortable or uncomfortable cultivating, and so on. Next. And so you might have guessed this by now, but there's no secret lever to switch on to make the transformational systems change we're talking about across your organization. Shifts in systems conditions are going to be the most impactful and sustainable when you actively work on addressing pieces of all 6 conditions. And lastly, to fully embrace systems change, individuals and organizations will also need to be prepared to see how their own ways of thinking and acting must change as well. We'll show you an example of that in practice here shortly.
All right, so I'm going to take back over here, and on the next slide, we're going to take just a moment to pause and process everything you just heard from Jess on those 6 conditions of systems change. And I'll ask our Zoom wizards to launch our next poll here so that we can have some time for reflection. And I'll ask you all to answer the 2 questions that you see on the screen. Which of the 6 conditions are you most comfortable addressing, or do you think you'd be the most comfortable addressing? And which of those do you think you'd be the least comfortable addressing? And I believe you have the opportunity to select as many as you want under the questions, but if you only have the opportunity to choose one, just pick the one that you're most comfortable with and the one that you're least comfortable with. So I'm going to be quiet for about 15 seconds to give everyone time to think about that. I'd like to just share a little bit that, these results I think are not surprising to me personally. I think I felt the same way as a majority of you all did in terms of those, structural and maybe semi-explicit spaces being more comfortable, or being where I felt more comfortable doing work, whereas those transformative pieces like power dynamics and mental models were something that took a little bit for me to feel like I could be comfortable even starting to address those. So thank you all very much for taking that moment to pause and reflect with us. Now, the next slide is asking a question that you might have right now, which is, why are we dedicating time on the agenda to review this framework? And the following slide includes a quote from the longer article that I referenced earlier that I think answers the why quite nicely. And that quote says that real and equitable progress requires exceptional attention to the detailed and often mundane work of noticing what is invisible to many. And I think this is just a reminder that that it's critical that we take the time to pause, even though we're doing really important work, and take stock of the systems conditions that we may not even realize we're maintaining, because we get into our routines of doing things the way we've always done them because it's comfortable, which is normal because we're humans and we like our routines. But if we don't intentionally stop and take a critical look at those systems conditions around us within which we're operating day to day, we're really at risk of perpetuating the conditions that produce the very inequities that we're hoping to address. So with that, I just wanted to elevate that as the why for this presentation today. I'm going to turn the mic back over to Jess to dive into our example.
Thanks, Anna. So this is the Water Systems Change Action Learning Exercise. It's essentially a collection of worksheets to help us slow down and look at our system. It's a three-part tool to think about social and organizational conditions to ultimately explore how your organization can pursue the large-scale change and what transformations might be necessary to get there. There are two assessment pieces that ask the exact same questions. One is applied to your external environment and opportunities to make progress, and the other is applied to internal conditions within yourself and your organization that need to change in order to better support equity. Following the external and internal assessment pieces, the tool then provides a what to do next section that can help with strategy development based on the assessment findings. Paige shared a PDF of the full tool in the chat, and we'll send it out after today's session as well for you to access. Let's go to the next slide. Thank you. I didn't know it was just on my end. So this is what the first part of the internal assessment looks like. We want to share an example now of what the tool and experience of filling out the tool can look and feel like, with the hope that you'll then consider using this tool with your organization. We applied this tool to MCHB as an organization, and I just want to give a huge shout out to Courtney Sally, a program manager on the Equity, EPI, and Eval team at MCHB, and lead of MCHB's internal equity committee, who really was invaluable in helping inform and /answer report on MCHB's equity challenges, opportunities, or strategies, but it is intended to provide you with a snapshot of some of our current thinking. Many of the pieces of this example also draw on an assessment that MCHB completed last year, where staff and board members participated in surveys and interviews to share their perspectives on MCHB's equity work. When you're completing this exercise yourself, it's important to collect as much input as you can from different perspectives to ensure you're integrating as many mental models as possible. Okay, with all of that being said, let's take a look at the example. Next slide, please. So for the sake of time, we're only going to highlight one condition at each level of the pyramid, starting with resources. You'll get the full example that we completed, including an assessment of all 6 conditions, in the slides after this meeting. In reflecting on how MCHB's resource flow supports or hinders our equity work, we acknowledge that our time and staffing is largely tied to our funding, which dictates and sometimes constrains our activities and ability to meaningfully advance our equity efforts. This is also where that common refrain I'm sure we've all used in our work fits in. If only we had more time and money, we would do X, Y, Z. I'm also seeing in the chat that my audio is a little funky, so I'm going to try turning off my video, Anna, unless it sounded okay in the past minute.
Sounds good now, Jess.
Okay, we'll just continue on then. Sorry about that. So on this slide, we're looking at power dynamics. And one major piece at the power dynamics level that came out in our internal assessment is that MCHB has historically had a predominantly white leadership. And this plays a role in who makes decisions for the organization and how our work is done at the practice and policy level. Next slide, please. And finally, for our mental models, we know we have to confront and challenge ourselves to move past the mindset of, well, that's the way it's always been done. Some of the practices, policies, and dynamics we found in our assessment are holdovers from MCHB's history, and it requires a shift in our mental models to even recognize that these elements require transformation. Next slide. And here's the completed diagnosis worksheet, just to give you a feel for how this all fits together. You can take a closer look at the other conditions and our reflections at each level when you get these slides after the meetings. I know it's a lot to look at on this slide, but the idea is that this process would be iterative. And once you begin having this conversation with your organization, you'll come back to these conditions often to reassess the elements of your internal system and how they may be hindering or advancing equity work in your current context. And I'll pass it to Anna to finish us out with the example.
All right, so just walked through the diagnosis section of the worksheet. And once you've completed that, it's time to move to the next one, which you see a blank copy of here on the screen, and it's titled Taking Action. And this is where you're going to start to answer the 2 questions that you see in that gray box at the top of the worksheet. And those questions are, what are the actions and strategies could you and your organization take to help advance your systems change effort, and who needs to be involved? Before we get into the next piece where I'm going to share some examples of how AMCHB has taken or is planning to take effort, I just want to mention that it can be overwhelming to think that you're going to have to address all 6 conditions of systems change in order to enact sustainable change. But the point here that I really want you to walk away with is it's about getting started and about having a long-term goal of eventually trying to address all 6 of those 6 conditions. And as Jess mentioned, systems change is going to be iterative, and you're going to want to revisit it as many times as you are able to. So one more thing I want to share here is that some of these actions that I'm going to share that AMCHB has been working on have been happening for 18 months and some of them even longer. So I wanted to provide that timeline perspective as we go through some of these. So on the next slide, I want to orient you first to how we've laid this out. On the top left, we have a mini snapshot of the diagnosis section that Jess went over, just to give you a visual reminder of what she brought up there, as I then go over the resulting action, which is the larger box in the middle of your screen. So Jess mentioned the challenge of feeling like there weren't enough resources to be able to do equity work. AMCHB addressed this, and one of the ways that AMCHB has tried to address this is by creating our internal equity committee, which, as Jess mentioned, is co-chaired by 2 of our fabulous EPI, eval, and equity team members, Cheryl Clark and Courtney Sally. This committee was launched about 18 months ago and is very intentionally made up of staff across all position levels, tenure, and identities. This committee also has a dedicated budget and dedicated time set aside every month where the committee gets together, discusses what they're working on, and the meetings have been structured in a way that they're working meetings so that things are getting done when the group is all together. I'll share as well that the IEC also functions as an organizational accountability mechanism, since the committee's charter very clearly outlines the responsibility of the group to support implementation of AMCHB's internal equity strategy. I do want to note, however, that this committee is not the only accountability strategy that we've tried to set up, and I'll talk a little bit more about some others when we get down to the mental models example. So we'll move into power dynamics, and as Jess mentioned, historically AMCHB has had a predominantly white leadership, and there's been two strategies that AMCHB is trying to implement to address that. And one of those is to transform the decision-making process to be more inclusive. As someone who considers herself mid-level at AMCHB, I can say that AMCHB leadership has been intentional in including all levels of staff in key organizational decisions. And one of the examples of this you'll see listed on our slide is the process in which AMCHB Strategic Plan is going to be developed this year. So I encourage you to take a look at that example. And then secondly, AMCHB is trying out some strategies to try to diversify our candidate pool for open staff positions. Some examples of this include reviewing and reworking our position postings to ensure they're as inclusive as possible, and doing things such as making sure that we're using neutral language and being mindful of physical and sensory demands, both of the application and of the position themselves. Position descriptions are also very clearly stating that our work is guided by our commitment to dismantling structural racism and rebuilding the systems that serve our communities in ways that center racial and other forms of equity. And finally, AMCHB is striving to move beyond traditional recruiting platforms such as Indeed and Glassdoor, and integrating Handshake, which I'm told by our lovely Chief of Staff, Nikisha, that it is an all-in-one early talent recruiting platform. So check that out if you're interested. And we're also being more intentional about connecting with historically Black colleges and universities and posting on university recruiting platforms more broadly. And so to wrap up this example, we'll move to mental models. And again, this is last but certainly not least. And this is what Jess spoke about, that mentality of that's the way it's always been done. And to try to address this, AMCHB has really articulated a commitment to regularly re-examining our old policies, even new policies, our existing policies, and our practices using an equity lens. And if that means that we need to scrap old policies and start from scratch, that's something that we're very willing to do. And here I do want to talk about our commitment to doing the work. And part of that commitment to doing the work is building in those accountability mechanisms. And one of those is our IEC, or our internal equity committee, that holds the internal organization accountable to its internal culture. We also have our individual employee performance plans that include a required equity goal, where each staff person has to demonstrate how they're contributing to the organization's equity goals. And that goal is scored along with all of our other goals in our performance plans. And those scores inform things like promotions and raises and bonuses. And then we also finally have our external joint commitment statement, which we hope many, if not all of you, have seen. And that is also something that we're hoping will work to hold us accountable. So moving to the next slide, I know that was a lot that we just threw at you quickly in that example, but the two completed worksheets are going to be side by side in the slide deck we send out. And again, you'll be able to take a look at an example of all the conditions, including the ones we didn't touch on today. And then on our closeout slide here, as Jess and I were preparing for this presentation, she suggested that we include this quote from Adrienne Marie Brown, who is an awesome leader and community organizer and someone that we both really admire. And that quote is that what we practice at the small scale sets the pattern for the whole system. I know that the 6 conditions of systems change can seem like a lot and maybe a mountain that's insurmountable, but we hope that Adrienne Marie Brown's quote can inspire you to make a change no matter how small, because we really can't even imagine the ripple effect that our individual actions have on the world that we live in. And nobody's paying me to say this, but I also highly recommend that you read her book, Emergent Strategy, which essentially really just emphasizes and shares strategies about how small scale organizing can affect large scale change. And so with that, we can go to our closeout slide. On behalf of Jess and myself, thank you so much for your time, attention, and presence with us here today. Jess and I would be delighted to connect with you all. If you have any questions or want to chat about anything we discussed today, I'll put our emails in the chat box, and I hope to connect with you all soon. Thank you.
That was wonderful. Thank you so much, Anna and Jess, for that wonderful presentation. We do actually have a few moments for questions. I know that was a lot of information. And if you do have a comment or a question, we would ask that you please use the raise hand feature in Zoom, so that way you will appear on our screen and we will know to call on you. You can also pop questions in the chat, as Richard just did. Thank you so much. The question is, what system exists that we can emulate? I find that a very interesting question, and I know that there are some projects with some community groups that we are working on that have a lot of promise. But I'm wondering if Anna and Jess have any possible answers, or if there is someone else who is doing something that just wants to brag about what's going on in your area. I also will say, Richard, that question is a nice precursor to what we'll get in sessions 2 and 3 coming up in March and April, where we actually will highlight some good systems that are actually working.
Yeah, thank you, Richard, for that question. And actually, Stacy, I'm right there with you. I'd love to crowdsource and see what folks think, what they're seeing, what they're doing. This meeting is for you all, and we know traditionally you've had the opportunity to chat with each other. So would love to hear in the audience what systems you see that exist that you try to emulate.
And there are several comments as well about getting copies of the slides. They absolutely will be shared.
I'll also just chime in, perhaps with a bit of a non-answer. I'm sorry, Richard, that, you know, as much as we look to other systems for examples, and that's a great thing to do, the idea with this tool especially is an opportunity to look at your unique context and to bring in community partners and folks with lived experiences to tell you some of those things in your own context that we at an organizational level might not recognize as easily or be privy to. And so just really putting an extra plug in for using this tool to identify places in your own system to make change.
I would actually like to put Jess and Anna on the spot for just a moment because you've given us such a wonderful presentation and you shared the examples of things that we're doing at AmChip. Can you just talk a little bit about what it felt like to go through that exercise so that people can anticipate what it will be like when they go back and try to do it in their own organizations?
Yeah, what a great question. Thank you, Stacy. And I think I cut out when I was saying it earlier, but just to reiterate, even if I didn't, Courtney Sally, a program manager on AmChip's Equity, Epi, and Eval team, was super helpful in pulling this example together. And it was really iterative. Anna and I worked on the example. Courtney helped us with it. You did, Stacy. And we just looked through the findings from that equity assessment, and we're really spending some time processing those findings in the different categories of the inverted pyramid, which was a new way of thinking about it, the assessment findings itself for me. And I will just be honest that it felt very vulnerable to expose AmChip's, growth areas, I'll call them, to this audience. And thinking through that example felt vulnerable, but it felt like something that was valuable for me to think about, and hopefully for you all to see that, we're all working on this and have room to grow. And on the flip side, it was really powerful and exciting to pull together the actions we've taken to address some of those growth areas and how far we've come and how far we have to go.
Wonderful. Thank you for being so transparent. And there's a note from Janice saying thank you for sharing as well, all the way from the U.S. Virgin Islands. We are actually ready to move into the next part of this session, which are the concurrent sessions. You'll see on your screen a visual that all of you got in your meeting invitation and registration information, and this kind of gives you a nice overview as to where we're going. So today's concurrent sessions will actualize broad approaches to addressing systems challenges. They'll be equal parts informative and interactive, and you may recognize that these approaches are aligned with the 6 conditions that Jess and Anna just talked about.
So as we move into the March and April sessions, the breakouts will pivot to provide space for states and jurisdictions to share and obtain feedback from peers on equity-related activities, no matter where you are at in your equity journey. In the meeting evaluation you will receive after today's session, there will be space to volunteer to share your work in a breakout session, as well as space to indicate if there are any states or jurisdictions that you would like to hear from through this meeting format. AmChip will begin outreach in early February to provide direct support to any states or jurisdictions interested in sharing. If you have any questions in the meantime, you can reach out to our team via our email address that you all have been probably receiving a lot of emails from. Next slide. So we are about to transition into breakout rooms. There might be some folks that are a little unsorted, but we will handle that as it comes, since I just had to jump in here instead of finishing the sorting. But we have 4 different topics that we're really excited to share with you all today in small groups. In each room, you'll be with an AmChip co-facilitator who will help get you started. We really encourage you all to participate in the discussion, share information with your peers, and ask questions of each other. We will be recording the content presented in some of the breakout rooms, not all of them. Your facilitators will let you know if it's being recorded or not. And we will not be including any comments or discussions from attendees in the recordings after the meeting. So we'll be sure to cut all of that for your privacy.
So now I can officially begin, which is to say hello, everyone. I'm Carolyn Stampfel. I'm the Chief Strategy and Program Officer at AmChip. My pronouns are she and her, and I'm facilitating this mini training, and this is called Hastening Internal Program Changes to Support Equity-Centered Title V Services. So I'm also joined by Mara Leahy, who's our Program Manager for Child and Adolescent Health. And among her many roles and talents, she's going to be our technical support today and my Zoom co-pilot. So our aims today, the session will help you to understand the actions we can take as individuals to use our own respective powers to improve the realities of those around us. And we'll talk about how the concept of being an ally increases the teamwork in an organization or collective. So as we get started, I invite you to introduce yourselves in the chat, share your name and where you're joining us from. And as we noted before we fully get started, just making sure that you know that we're recording this breakout session for people who aren't able to attend. And any conversations that we have about personal experiences are going to be cut out of the recording so that we're just sharing the training content and my narration of it. So hopefully that's all right with you. If you have an issue with that, please feel free to jump back to the main room. There are 2 other concurrent sessions running the same content, and those are not being recorded. So this session is an adaptation of the Lean In's Allyship at Work workshop, and we're going to share some additional materials and resources from Lean In that you can explore on your own after the session. And everything from the Lean In Allyship at Work, all of their workshop and training materials are available free, no cost on the website. And so that's part of why we're using them, because then we can train you and you can use those trainings for others. Thanks. I'm starting to see some folks introducing themselves in the chat. Please keep that going. So throughout our time together, next slide. Yep. Throughout our time together, we're going to invite you to share your experiences and discuss what you're learning. And I wanted to make sure that you know that these discussions are going to feel like a space where everyone can participate. So we're going to use some ground rules to follow, and you can think of them as ways to start being an ally even in your workshop. So stay committed to the ground rules as an important step in practicing allyship. First is to share the mic. We want everyone to have a chance to speak if you want to. So if you're exploring an area where you hold a lot of privilege, be mindful of not dominating that conversation. Commit to confidentiality. Don't use other people's names when sharing stories, and anything that is shared here should be kept confidential. Be mindful of your aha moments. This is a program that's meant to prompt people to see their experiences at work and the experiences of others through a new and different lens. So be mindful that you might be seeing something in a new way for the first time, but it may be part of someone else's day-to-day experiences. So if you choose to share an aha moment, be aware that your surprise at discovering these experiences might be painful for someone else who has to live them daily. So as an ally, one of the things you can practice is prioritizing the impact that your sharing might have on others in your group, and think about that over your excitement to share it. And then we're going to go on to our next one, which is don't question others' experiences. We all bring different experiences to the table, so we're going to ask you, do not discount or invalidate the lived experiences of others. And in particular, if someone shares something about an inequity that they faced, as an ally, believe their experience. Don't ask for proof, and don't try to provide an alternate point of view. And then finally, we're going to ask you to give each other kindness. Some of the conversations are uncomfortable, but we want you to believe that everyone here has the best intentions because they showed up to the training. So be patient when we make mistakes. And I say we because we all make mistakes. If someone shares openly, please thank them for their experience before moving on. So on our next slide, and thank you for continuing to introduce yourselves. So the Allyship at Work training covers a number of topics. We're going to talk about what allyship is and what it isn't, unpacking our personal privilege in and outside of work, learning about the inequities that impact people with less privilege at work, discovering what power we have to enact change at work, learning specific actions to practice allyship, and then reviewing the active allyship framework. So that's a framework of components that we'll explore throughout the program. This actually is intended to be a 4-hour workshop, and we don't have that much time. So what we did was a very mini version of this based on the Lean In framework. So we're going to focus on just a few parts of the framework: power, actions, and the framework itself in the agenda. And hopefully you will feel energized to go and explore some of the materials that are a little more about your individual work and situations and the workplaces and programs you interact with in your daily life. So we're going to encourage you to take a look at some of the online resources, especially for section 2, which is unpacking your privilege, and we're not really going to touch on that at all. We have found as facilitators that a lot of trainees get stuck on certain spots and maybe don't get to the part where you explore the things that you can do and how those play out as examples. So we're going to sort of move and shift into those active pieces a little bit more quickly than most trainings do. So there's a personal workbook that's available for the full training, and that includes the individual activities, the resources, and a glossary of terms. So I believe I have the link ready to go and sharing that with you. It's not coming up as a hyperlink, but if you paste that into your browser, you should be able to get to the workbook. You can explore it after the session, and there are some assessments that you can do as individuals, and then kind of think about that. And everything that you do in there is going to be saved on your local computer, so it's never going to be shared with anybody. And then you should have received an email before the session that had 2 videos: what is privilege and what is allyship. So hopefully you had a chance to take a look at those, but we're going to review the definitions to ground us in some of the work and encourage you to explore all of the additional activities later after the session. So on our next slide, we're going to define privilege. So privilege is unearned advantage people have from being a part of a dominant group whose needs have been traditionally prioritized. And we had a whole wonderful introduction to systems. And when we talk about people's groups' needs have been prioritized, we're talking about in things like the systems that are all around us. So we can see that privilege is experienced because of things like gender, race, sexual orientation, ability, class, religion, or other identities. And many of us experience a combination of privileges and disadvantages. So as a white woman, I experience whiteness as a privilege, and gender in some spaces is a disadvantage. So identities are complex and privilege is complex. Privilege isn't something that we earn or choose. It's structural, again, talking about structures and systems, because society prioritizes some groups over others. So while we can't control whether we have privilege, we can become aware of it and then use that awareness as a crucial step to be able to use our privilege to support and advocate for others and become allies. So on our next slide, we're going to talk about allyship. So allyship is the active and consistent effort to use your privilege and power to support and advocate for people with less privilege. So thinking about the 2 main components, it's active. So allyship involves understanding inequities and taking concrete steps to help level the playing field. And then it's consistent. So it's not about any one action or doing that one action perfectly. Or only being an ally in a certain situation. Allyship is about acting consistently in ways that add up over time. So on our next slide, we're going to talk about an important component of allyship is doing the work to understand our privileges, our intentions, and our role in any given situation. So I'll share why I'm facilitating today. So I can be really explicit in moderating this and model for you. So we heard in the general session, AMCHB values health equity and social justice. We made a commitment to be anti-racist and to work for racial equity. And so for me, allyship is a way to bring that commitment to my individual actionable level. Allyship is everyone's work, and it's largely the work of people with privilege to support and advance those with less privilege. So I hold privilege as a white, straight, upper middle class cis woman, and it's critical that my allyship is informed by the groups that I aim to support. So understanding and owning that unearned privilege I have in spaces is a way that I can use my privilege to help other people. So it's important that I'm doing the work myself and build my understanding and awareness so that the burden of promoting equity and educating about equity doesn't fall on those with less privilege, as it has traditionally tended to do. So on our next slide, we're going to start moving into what this looks like and what we have from support from data to talk about allyship. So most of us probably understand that acting as an ally is important in making people with traditionally marginalized identities feel included and supported, but it's not just about our individual actions. We have research that shows that allies don't just influence one person at a time, they inspire others to act as change agents too, creating a culture of acceptance and support. So simply put, allyship is a powerful force for good. Allyship can shift organizational culture in a way that promotes equity. When workplaces are more equitable, employees are happier and more committed. And then how you do your work as a team becomes more equitable, and your programs and your partnerships can become more equitable. So if you are thinking back to the plenary where we're talking about systems, the quote that we heard, what we practice at the small scale sets the pattern for the whole system. So think about allyship as being that pattern. In Title V, systems work is what we do, and systems and practices and policies, those are all powered by people. So allyship at the workplace and with your team is a really powerful place to focus on shifting conditions towards equity and changing systems. On the next slide, we learn that one of the problems we have is that too few employees with traditionally marginalized identities are getting the allyship that they deserve. And this was in one of the videos. For example, only 16% of Latinas report that Latinas have strong allies in their organization, and Black women are even less optimistic about the level of allyship that Black women receive. Right? So these are our data points. On the next slide, we know that part of the reason for this is that there's a gap between good intentions and actual actions that are being taken. So while a majority of employees think of themselves as allies, relatively few white employees are performing basic allyship actions, such as advocating for racial equity or mentoring women of color. Over the past year, with renewed commitments to allyship, even more white employees see themselves as allies, but Lean In's 2021 data shows that white employees still aren't taking the basic allyship actions. So on the next slide, with materials that we shared in the participant workbook and the videos, they take a broad look at how to be an ally at work to people with a wide range of traditionally marginalized identities. And we recognize that that can look different for everyone because no two people are the same. So the resources focus on the experiences and needs of the LGBTQ community, people with disabilities, people of color, women, and people with intersecting traditionally marginalized identities, religion, and class. So there might be identities or experiences that aren't covered in the materials, and it's not intended to be exhaustive. It's meant to be a starting point for your allyship journey so that you can learn how to best support your colleagues with traditionally marginalized identities. It's important to note here that Lean In built their program in partnership with people who have all of these identities, because true allyship centers the voices of those impacted by inequities. So I hope that you'll explore those resources and read the stories that are in the participant workbooks that are shared, because they are bringing in all of these different folks with different identities. So I wanted to pause for a second because I know our time is short together, but we do want to be able to share some examples. So have you seen examples of impactful allyship in your workplace or life? If you've seen something that you felt was particularly impactful, would you share it in the chat? You're also welcome to unmute yourself and share with us. Thanks, Mara shared our prompt. And you can also think about this and chat in as we move through our training. Okay. I'm not seeing any chats come through. So we can move to our next slide. And if we have some examples that come in, I'm happy to pause and share them. So we can move briefly to a discussion of inequities in the workplace. And I want to again emphasize that there are many opportunities to explore this in the workbook, but we're going to just touch on a few brief examples here. So on the next slide, the common areas of inequity include, and these are categories, everyday interactions, workplace norms and expectations, hiring, advancement and recognition, mentorship and sponsorship. While many of these might seem to you like you have less control over them, especially if you're working in a highly structured state governmental agency, it's important to find where you can use your power. So for instance, in hiring, are interviews held in a way that's accessible to people of varying abilities? Are phrases like culture fit really about people who look like you or have similar life experiences to you? So you can take some time to explore these and other questions in the different workplace categories. We're going to go to the next slide and talk a little bit about the power, discovering the power that we have in the workplace. So on the next slide, what do we mean by power? So for the purposes of our session, we're defining power as your ability to make an impact at work. When we leverage that power to help others, we can begin showing up as effective allies. So on the next slide, power can be influenced by a lot of factors, including but not limited to our position at work, our privileges, and our relationships. So for the purposes of our workshop, we're going to focus on positional power, the power that you have that's based on your role and your level. That often means that as you become more senior, you have more power to enact change and to influence organizational culture. So on the next slide, it's important to remember that we all have forms of power. So often what happens is we underestimate our power and the impact that it can have, especially if we're earlier in career or not a senior, but participation across the levels of an organization can make a big difference. Remember, we talked about allyship as being a way to create culture change. So maybe you aren't a hiring manager, but you do participate in the interview process. Maybe you don't run a large team, but you do run weekly meetings with a lot of people. Maybe you don't make decisions about workplace facilities, but you have a good friendly relationship with someone who picks the locations for informal social events. Maybe you're not the named director or lead of something, but you've been in the organization for a while and you have information about how things work that other people don't have. And that's a really big one because information equals power. People who have more information have more power. So maybe you're the director or the lead of something and you set the vision for your program, but you're part of a larger agency. Using the power that you have and the spaces that you have access to are ways to practice allyship and shift the culture towards equity. So research that Lean In has done shows that when employees at all levels are invested in organizational change and act as change agents, the new behaviors stand more of a chance of becoming those shared values and parts of the culture. So we're going to pause for a moment and take a moment to think about opportunities that you have to use your power to practice allyship. And if the magic of Zoom works, we're going to pull up a poll so you'll be able to chat in your responses. So there's a response feature so you can share examples of power that you have in your role to practice allyship, or a type of power that you have that you hadn't thought of before.
Carolyn, this is our Menti poll, right? All right, we've never done this before, folks, so let's see if this Zoom magic works. Carolyn, are you seeing anything?
I am not.
Let me stop sharing this and I should be able to share this. Is that working, Carolyn?
I can see it. So I think if you want to add a response, you're going to go to menti.com and then use this code that's at the top. Oh, there you go. Mara beat me to it. All right, we have a first taker. So someone mentioned interviewing employee candidates. Okay, so part of that hiring process. Other examples that you can think of? Active listening to community partners. Great, thank you. Oh, providing upward feedback to leadership. Yep. Engaging stakeholders. Great. Any others? Selecting grantees and where our money goes. Yep. In addition to information being power, having decisions about funding is certainly a power position. Helping to plan meetings. Yep. Design of RFP or grant solicitations. Yep. Longevity knowledge. Yep. That's that knowledge and information. Access to things that other people don't have access to. Great. Thank you all for participating in the Menti. Ooh, I see another one. Participating in hiring practices and interviews. Great. All right. I think we're ready to go back to our slides just because I'm watching the clock and I hate to rush us through any part of this. But I want to make sure that you get to see all of the content today. Okay, so then on the next slide, we're going to discuss some really specific strategies and actions that we can take to practice allyship effectively. So next. So there are allyship actions that we can take at the individual level, interpersonal, and structural levels. And as we go through these, I'm going to illustrate with an example around creating more inclusive meetings and share some specific actions at each of those three levels. And why are we using this example of inclusive meetings? Well, meetings are a really critical part of the workplace and culture. They're where we build credibility, we collaborate, we earn respect from colleagues, and we interact with our peers and with our leadership. But they can also be times when people with less privilege are less heard from than others. And many of us are facilitating or coordinating meetings as part of our programmatic work. So improving it internally can help us externally as well. So thinking about examples of allyship, as you listen to these examples, thinking about things that you've seen or that you've done, and then we'll ask you to chat in examples that you've seen or done. So for individual allyship, our actions to educate ourselves, to model inclusive behavior or change our mindset. So that's sort of our definition of individual allyship. And our example is in meetings, you can share your pronouns, use inclusive language, observe group dynamics, and challenge your biases, and doing that in each meeting that you participate in. As part of interpersonal allyship, that's defined as our actions to support, to surface issues, or to push for changes through our day-to-day interactions with others. So if we think about this idea of inclusive meetings, that's about giving credit, reducing interruptions, and inviting more voices to the table. Then for structural allyship, our definition is actions that are pushing for change in norms, policies, or systems. So a way you can practice that in more inclusive meetings is to change the structure or the norm of the meeting by distributing speaking time. You can use tools or methods for offering input to ensure that people who like to give input in different ways are able to share their expertise. And one of my favorite things as a very much an introvert is to provide people ways to write feedback and to think about and bubble on something. We kind of refer to it as crockpot thinkers, right? Some people are not the first person to raise their hand, but they have wonderful, valuable input. They just want to think about it for a little while. So what are you doing as part of inclusive meetings to change that structure? So it's not just the fastest hand or the most outgoing folks who contribute to meetings. So you can ensure that all of your meeting environments are accessible. So thinking about these different levels, individual allyship, interpersonal allyship, and structural allyship, what examples have you done or seen or would like to see in your workplace? So you can share those in the chat, or if you've seen something and you want to share it out loud, please feel free. And I recognize that it might take you a little while to type it in. So I'm going to just go through the very brief last part around the allyship framework so that you get to experience all of the content that we have today. And then if any examples come in, I will highlight them. So yep, we're going to review the active allyship framework, and that pulls all of our concepts together. So we've touched on different elements of the framework, like seeing your privilege, identifying inequities at work, and considering actions that you can take, and then using your positional power. So there's many ways to practice allyship depending on what privileges you have that you can leverage, what problems or inequities are showing up, and what power or opportunities you have, and what action you want to take. The active allyship framework is meant to help you connect the dots between those pieces and think about how to best use the privilege and power that you have to address inequities, or in other words, how to practice allyship. So you'll see that the framework is not linear. There's not any specific order that you need to follow, and you don't need to formally run through it to be an ally, but it can be a helpful tool as you frame and think through and plan and reflect along your allyship journey. And the purpose of the framework is to show how privilege, inequities, and positional power are all connected in your ability to show up as an ally, and help you remember the components of allyship. So on the next slide, we talked today about positional power. We learned that our power is our ability to make an impact at work, and that our positional power is the power that we have that's based on our role and our level. And then we talked a little bit about allyship actions. So we dove into actions to practice allyship across individual, interpersonal, or structural strategies. And we identified some strategies that we can practice given our power and privilege. So I do want to thank you for taking the time to spend with us in this workshop. And I'm really grateful that you chose to be here today. And we know so much of allyship is showing up, actually doing the work, including learning foundations and the ongoing learning and taking actions. And so I want to thank you again. Thank you for participating. I saw that Jamie put in the chat, tools like Menti can give everyone an equal voice. And I love that tool also because it can create a space, it's not identified, so people can share some of their thoughts if they're not ready to be vulnerable. And it is a wonderful way to level the playing field, so it's not always your folks who have the quickest hand or the loudest voice to be able to participate. Again, I wanted to emphasize that the Lean In participant book has a ton of options for going through the different examples and a lot of the sections that we didn't touch on today. So please explore that. And if you are interested in going deeper, we have a poll. We were wondering if anyone would like us to do the 4-hour version of the training, which is the full version. So I think, Mara, we have one more poll, and I think it'll be a yes, no, or maybe. But thank you so much for your hanging in, for your participation today. And we appreciate you. We look forward to seeing you in the next couple of partnership meetings.
Great. Thank you so much, Athea. This is wonderful. Thank you for inviting me to be here with you all today and share a little bit about my work and some of the things that I've been doing in terms of messaging development and tailoring for different audiences. I'm going to share my screen really quickly here. And Athea, I see your face in my tiles. Can you just give me a thumbs up if you see the slides? Okay, great. Perfect. All right. So again, thank you so much for being here this afternoon. I am a public health communicator with nearly 20 years of experience. I've worked in a variety of different types of health issues, topics, types of programs and campaigns over the course of my career, and also spent a little bit of time not in public health working on brand work in New York City, and so had the opportunity there to learn a lot and then bring those skills back to public health and public sector work. I want to start out today. I know we are operating as communicators in a very difficult time with lots of messaging, lots of channels, lots of misinformation, and in particular, lots of polarization. And I'm sure this is something that you have experienced in your professional and your personal lives, just how deeply divided we are in terms of political polarization in this country right now. And I don't mean that in terms of, oh, we've got differing opinions. It really is this sort of deep-seated difference. And there's actually quite a lot of animosity between groups because of what side of the aisle you may sit on, because of what you think about different issues and topics, because of how you vote. And in particular, there's data that suggests that the number of Americans who consistently express either conservative or liberal opinions, it has doubled over the past 20 years. So going from 10% to over 20%. And not only are we seeing this polarization, but really what we're also seeing is this alignment more strongly between political beliefs, partisanship, and what you think about issues. And so people are, tending to skew one way or the other, singularly around issues, political orientation, and sort of kind of the people around them and what they believe, and who they're influenced by in multiple channels. And in particular, we're seeing these trends happen faster in the US than any other democracy. And so I want to just ask a quick survey because this is something I feel like is universal, but I want to hear from you all. And I think, Athea, there's going to be somebody who's going to put this as a poll through Zoom. But the question I want to hear from you all is, are you seeing polarization amongst the audiences you serve in your own work? So I think if you vote, we'll look at the results in 1 second. Okay, great. Okay, yes. So majority of us, 75% of the folks in this room today are seeing this kind of polarization. It looks like a few are not seeing such differences amongst the groups they serve. And then maybe there are a few people who are unsure, and we'll get into that sort of being unsure piece in a little bit as we go forward. So one of the things I think that is really compounding what we're seeing today, although it is not solely responsible for it, is the impact of social media. And there are multiple sources that document how social media is now the primary channel for people to get news through. And in fact, they're hearing it in social media first before they're hearing it in sort of a more traditional news station, either radio or television. We're also seeing data that suggests that just as of 2019, the amount of people who are getting news through social media has increased by 10%. So within a year, these data were released in 2019. So within a year, there was a 10% change in people accessing their news through social media, solely or before getting it elsewhere. So this is really impacting kind of how people are getting information and where they're getting information and through whom they're getting information. And in fact, the challenge with this is that social media really, because of how it's built and the algorithms that it uses, it's sort of focused less on information and more on engagement. Information that is inflammatory, sensationalist, those things are always more exciting, even if they're false. And so those things tend to get more likes, more shares, more comments, and therefore they're raised up in the algorithm of many of these platforms. Therefore, they're seen more often by more people. And these algorithms end up both amplifying information that is not necessarily true. It also allows us to sort of live in echo chambers, right? So we get to promote our favorite narratives. We get to surround ourselves with like-minded individuals. We get to curate the pages and the profiles that we subscribe to and get information through. And this really ends up creating these polarized groups. And when we see information that comes from outside of those groups, there's real resistance to accepting or listening to that information when it doesn't conform to kind of the things that we already believe or prefer to hear or see or read. And I will say there's data that suggests that the average user only reads an article for about 15 seconds or less. And the average video online is watched for only about 10 seconds. So people are really getting only a snippet of information. We've heard, the terms clickbait titles, right? So the titles that trigger somebody to click and find out more, but really are not filled with information. Those kinds of things are what people are seeing and engaging with online. And because our attention spans are shortening, we're not really going beyond kind of the superficial level of what's being put in front of us in order to get more information, go deeper on certain topics. And this actually, just to go back a moment, these data are supported by other data that were released in 2019 that found that, in fact, people who get news in social media know less about current events. So they might be consuming a lot of information, but they're actually not necessarily always up to speed on what's going on in sort of the current events and the news of the day. And there's additional research that suggests, and this gets to those clickbait titles and the social media algorithms that promote sort of sensationalist content, falsehoods diffuse significantly farther, faster, deeper, and more broadly than the truth in all categories of information, and that includes health-related information. So this has some substantial ramifications for health programming, right? So we think about our own work, the work that you're doing in your day-to-day job, and how we're trying to get our message into sort of those feeds of people if you're using social media, but even if you're not using social media, right? You're trying to message to people through radio, through influencers, through community leaders, through churches, through barbershops, through print publications, through local newspapers, whatever it may be. You're trying to share your message, you're trying to get it out there. And it's really hard to fight the information that people are being exposed to on all these different channels that may be counter to what you're trying to say. And in fact, for health, this really creates it's not just that it's like, oh, well, okay, I'm selling a product and no one wants to buy it because somebody has come along and said it's not a good product, or I won't go to that restaurant or see that movie. With health, we're talking about lives, right? This is really has the potential to have lasting impact on people in terms of their health and well-being, and the health and well-being of their families and communities. And we see this with things like QAnon and some of the crazy stories that have surfaced in just the last 2 years of the pandemic, whether that's the drinking of the bleach, or it's the ivermectin as a treatment for COVID, any of those, but they go far and beyond COVID. These things are proliferating online, and people are listening to them and believing them. And this is just another news headline I wanted to share. It's again sort of the connection between coronavirus and Corona beer, and sort of just how people are being influenced by some of this misinformation, depending on where they're seeing it and who it's coming from. And in fact, there's a large body of literature that that documents the role that the internet has played in disseminating anti-vaccination information. So just to kind of bring it back to health specifically, the role of the internet in misinformation for, in terms of the vaccination debate is deep and broad and well established, that there is a role there. Anti-vaccination has been a thing well before the internet, but it has really put it on steroids so that those voices are amplified through the channels and the ways that I've just reviewed with you. So I'm going to just pause here again and ask another poll question to the group. So the question for you all is: the role that social media is playing in promoting misinformation is of great concern to me. And so if you could just vote strongly agree, agree, neutral, disagree, strongly disagree. Have only 1% of this group in the neutral category, and other than that, the vast majority of folks here today are concerned about the role that social media is playing in promoting misinformation. Okay, so I just want to kind of move to talk a little bit about some strategies and some ways of thinking about communicating in this very challenging space. So there is actually a lot of work done, research done and published on messaging around difficult or polarizing topics. One of the largest bodies of work are sort of related to this is the climate change space, and how divided we've been on climate change for so long. And now we're starting to see that on other things and other topics. And so I'm going to present to you today a couple of highlights from that work, but it actually pulls from broader than climate change, but that is a deep body of work if any of you are interested in learning about this more. So overall, there's sort of some data that suggests that findings really differ in terms of how messaging can persuade people about key health issues. There's not a definitive, this is how you do it, this will work for sure. And I know that may sound disappointing to you, but the fact is that this is difficult stuff, right? It is really hard to talk about issues that people feel very strongly about and have very strong opinions against, and find ways to message to them, and also to find ways to message to different types of groups about the same issue, right? So even just thinking about segmenting your audience and tailoring your message, like this is not for the faint of heart, let me say. It takes work, it takes research, and we'll go into some of those things as we move forward in this presentation. So I want to give you a couple of strategies that are referenced in the literature around messaging in terms of constructing effective messaging for difficult or polarizing topics. And those include things like using framing strategies. So framing strategies refers to the idea that you're sort of pulling out key pieces or elements of a topic, and that is how you are framing your message, right? So you're using it to kind of highlight certain aspects that speak to a particular nuance or reality of a specific group you're trying to reach. Another strategy is reducing psychological distance. What that means is that with some of these topics, we have what's called social, temporal, or physical, so psychological distance. That means it won't happen to me or people like me, it happens to other people. The temporal is it won't happen now, it's going to happen sometime in the future. I don't have to worry about that. And the physical is it won't happen in my community, it'll happen somewhere else. So by addressing the fact that whatever your topic is can happen to somebody in particular, can happen in a particular community, and what could happen now or sooner than they may think, that can help address those psychological distance, the psychological distance that people have. Emotional appeals, and I want to link emotional appeals with efficacy cues because the two go together. Emotional appeals are, of course, leveraging emotions to make a point about something. And it can be extremely effective in terms of drawing on people's heartstrings, making them care about something, making them fearful of something. But it is well documented that fear appeals, emotional appeals, those kinds of things don't work well on their own. They work well when you pair them, especially when you're talking about fear appeals. They work well when you pair them with efficacy cues, which means not only are you giving people information about what their risk is and what, essentially what they should be fearful of, but you're giving them the tools to understand both how they can be capable to address those fears themselves, and that by doing so, they can actually avoid that risk. So it's the mix of emotion and efficacy that is that sort of 1-2 punch that works really well. Weight of evidence, weight of expert reporting. This is a theory because that evolved out of the fact that reporters often, in order to be objective about something, will report equally on multiple sides of a topic, even if one or more of those sides is less well substantiated, right? There's less consensus amongst experts for a particular point of view. There's less data or evidence to support that point of view. So rather than thinking about portraying both sides of an issue equally, there's the weight of evidence, weight of expert reporting theory that suggests that you should present both, but you present the one where there's more consensus amongst experts and more data and evidence more substantially. So it gets a greater share of voice in whatever it is that you're reporting or messaging about. There's also inoculation, correcting misinformation. So inoculation theory has to do with understanding what the fears or concerns are amongst your audience and proactively addressing those. So tailoring your message so that it actively goes out and says, you may be concerned about X, but, and it provides an alternative to what that person might be fearful of. And then separating science from conspiracy theory. So this just has to do with this idea that you're sort of taking on the conspiracy theory or the misinformation directly and providing the science that addresses that. So those are some of the ways that messaging communication experts or some of the methods, I should say, that they use to construct effective messaging when they're talking about difficult topics. I want to propose to you a couple of sort of broad sort of tenets to think about as you're working on your programs and developing messaging for your audiences. And I want to start with this idea that not all counter beliefs are irrational. And I want to start here because there was a light bulb moment for me when I was working on my dissertation. I was taking a class and we were looking at the theory of reason and action. And I had heard about this theory for many, many years in my work prior to going back to school for my PhD. And essentially, the theory says that, the behaviors that lead up to a particular belief or behavior they're all rational steps in the process. And what really kind of got to me in that moment was the fact that that does not necessarily mean that the outcome behavior or belief to us is rational. It just means that the getting there is a rational process, whether that's because of social norms, efficacy beliefs, other information that's coming in to impact how somebody thinks about an issue. all of those pieces become rational steps in a rational process to get to an endpoint, even if that endpoint to you or I is, or to you or me is not necessarily a rational outcome. So it's really important to understand that when we are facing counter beliefs, things that are sort of counter to what we're messaging, that those things are not just, categorically wrong or incorrect or irrational or don't make sense, even in the context of somebody doing one thing and saying another thing. They really are in people's heads, and the way that they think about things, there's usually a rational argument to why they believe that, even if it doesn't make sense to us. So I really think we need to come at this messaging from a place of compassion and humility and understanding that what people are thinking may not be correct, but it's what they're thinking, and we need to acknowledge that in as part of our process. The other thing that I think is really important to think about is that areas of uncertainty exist when exact knowledge does not exist or knowledge is shifting. And to me, this was COVID 101, right? In COVID, we have seen the sausage making of science play out before our eyes. And I think what's really important is that has created a lot of uncertainty for people as guidance and direction have shifted. I think that is confusing for people. People sort of tune out after a while because they're like, well, I don't know what to believe or who to trust. So I think that we have to accept that when we're talking about difficult topics and we're messaging to a polarized group of people, there's great uncertainty. And especially when there's exact knowledge, when we cannot be 100% confident in the things that we're saying are the right thing to do. I want to emphasize that related to that makes the power of research paramount, because what we want to do is understand what's going on here and what's going on here in order to be able to start to craft messaging that speaks to those experiences and realities. So I know that in public health, we are constantly facing limited resources, trimmed or cut budgets. We have, one of, I think, the things that has come to light in the pandemic is the underfunding of the work that this community does. And I think that makes it really hard to message against some of the things that we're facing today. But however you can do it, I want to emphasize that talking to your audiences, understanding what they're thinking, what they're going through, is so valuable, even if you can do only a little bit of it, because it will really help to get to this next phase, which is tailoring your messaging. And you may not like to hear this, but there is no longer a one-size-fits-all messaging, I think, when it comes to health. If only because we want to make sure that we are speaking to as many people in the ways that they understand and will be receptive to. But we can't use one blanket message for everyone. It is efficient, but it will ultimately not be effective in terms of having your message listened to, paid attention to, remembered. And so I think the idea of tailoring your messaging to the drivers of people's belief, again, what we learn in research about what people are uncertain about, and also how they think about these things, even if the outcome is irrational. We really need to be thoughtful about understanding those things in order to develop messaging that addresses those things. And then, of course, the messenger is very important. And this is the case for consistent or changing information. And you may already be doing this. You may already know the importance of messengers, but this is going to be particularly important as you think about not just the tailoring of the message itself, but also how do we get the messages out to the communities that we're serving. And I think what is most important here is understanding that you or your organization may not always be the best messenger. It may be in certain circumstances, but oftentimes we're looking to those community leaders or those church leaders or those moms and dads on the PTA, or social media influencers, or other types of people who have sway and influence with certain groups of people and can be quite effective in getting that message shared and listened to. And there's a lot of literature on the role of these messengers, you know, opinion leadership, that idea in terms of the effectiveness for public health messaging. And it has been shown to be quite effective. And so remembering how important the messenger that you choose for your message is almost as important as the message that you've crafted. I also want to end with just two, and I'm looking at the time and we're right at 15 and I have many more slides. So really quickly, just again, what is perceived as trustworthy is situational and can be negotiated. I think one of the things is that we are in a time of lots of information coming at people. There is lots of shifting in terms of people's thinking and the information that they're exposed to. What is trustworthy today may not be trustworthy in a year or 6 months. And just remembering that we need to keep a pulse. Athea, are we ending? Is that what's going on?
I don't know what happened there, Amelia. No, we still have about 4 more minutes.
Okay, perfect. Great. So I'll just move quickly through the rest of the slides here. So, and just finally realize you won't be able to move all people. I think we have to just be both realistic, but also give ourselves our own, you know, sort of sense of compassion that we're doing the best we can. There are people who we will always not be able to reach and persuade. So it's really focusing in on those groups that can be persuaded in order to sort of reach as many people as we can will be really important as you think about your strategy. So in the interest of time, I'm going to skip this poll, if that's okay, Athea. Is that a problem? Okay.
That's right.
I just want to quickly give you a highlight of a campaign that I've been leading in the last 2 years during the course of the pandemic. It's called How Right Now, or ¿Qué hace ahora in Spanish. And we, you know, in the spirit of research, we did robust but rapid research under in the early days of the pandemic. You can see sort of in a quick summary here: environmental scanning work, social listening work. We did needs assessment calls, listening sessions with community members, focus groups, and an online survey, all in English and Spanish. And we really heard from people, and we wanted to explore people's experiences in COVID around mental health and coping and what they were going through in the early days of the pandemic. And what we really got through this research process was that people wanted their feelings and experiences validated. They wanted to know that they were not alone in what they were going through, but they also recognized this need for hope and resilience and the need to cope. And so it really ultimately ended up allowing us to create messaging that both acknowledged what people were going through, but gave them strategies and ways to cope in order to kind of address what we heard that they both experienced, but also needed in that moment. And as we, and so this is what I'm hoping will be useful to you. So what we really wanted to look at in terms of the messaging development here was, what did our audiences say they wanted, and what did they already have? And then how could we amplify and bring those two things together and fill in gaps that existed? And so in terms of our messaging strategy by group, we had our audiences. Through our research, we identified their biggest challenges, and then we started to identify possible solutions. And those possible solutions ended up turning into messages that were disseminated through partners, influencers, celebrities, and through a little bit of paid advertising. In terms of our reach, you can see that each of our channels for dissemination offered a certain amount of reach to our audiences that we were trying to support through this time. And then we also looked at source credibility in our evaluation. And you can see that groups and foundations working in health community organizations, again, those trusted messengers were really highly trusted. And even though celebrities and influencers were sort of amongst some of the lower groups, we did notice that amongst some of our groups, and especially amongst communities of color, celebrities, influencers were more highly trusted. And so it really kind of rounded out this idea of leveraging a mix of voices and a mix of messengers to get our messages out. So just in terms of some of the findings that we got from this experience, but also I think these are sort of, I tried to generalize them a little bit for you as you kind of come away from this presentation. I think as we're in this day and age, not just in the pandemic, but just generally speaking, there's lots of change. Things are changing day to day. New issues are emerging. Old issues are coming back. People are sort of, have whiplash from, is something important to be aware of anymore? Has it moved on? Has it died down? Our news cycle is 24 hours. There is a lot coming at people. And so thinking about your campaign or your messaging implementation really is flexible and nimble, I think will help you kind of approach messaging in a way that meets people where they are in that moment. We did ongoing data collection and we analyzed multiple streams of data while the campaign was in market. This really helped to understand what people were going through and how needs were changing and how we could be responsive to those needs. In terms of influencer approaches and ads, those really helped with expanding our reach to our audiences, especially for Spanish language speakers. And then messaging that has that 1-2 punch that I mentioned earlier, it's sort of acknowledging what people are going through or what they are currently concerned about, and then giving them actionable suggestions is really important. And then ultimately, these things help to increase the reach and engagement of the campaign, and applying something similar could be potentially really valuable to your own work. So I will leave this here. These are just some lessons learned and implications that reiterate what we've talked about. And I think we're at or over time. Athea is sort of flagging me down in her tile. So I will pause. I had hoped for questions, but we may not have time. So I'll turn it back to you, Athea. Thank you.
Thank you so much, Amelia. And thank you for all who participated. There are a few questions in the chat, but unfortunately we don't have time for them. I'll share those with you, Amelia, after, and maybe we can get some responses from you. Amelia's slides will be available, and this session was recorded. So you can take a look and share with your colleagues after. Thank you, and I'll turn it back over to our other MC.
I'm actually back. I survived being kidnapped by the Zoom monster. I'm so sorry, but I hope that everyone had a wonderful time in their concurrent sessions. This brings us almost to the conclusion of session 1, but before we go, I'd like to ask folks to pop into the chat just a few words of reflection about what you experienced today, and then also please do remember to do the evaluation. And in a moment, I'll turn it back over to Dr. Warren because we've got some awards to give away, which is so exciting. Thank you so much, everyone, for attending today. Dr. Warren, I will turn it over to you.
Thank you so much, Stacy. Want to thank our partners at AMCHB and the various presenters for a fantastic presentation today. I was in the breakout session on allyship and power, and really appreciated very practical learnings from colleagues across the country. This is one of the reasons that this meeting is always so helpful, and really appreciate AMCHB's leadership in raising these topics that are so helpful as we work to advance equity across the country. So thank you. It is now my pleasure to move us into the awards ceremony. One of the things we always do at the partnership meeting is present the MCHB Director Awards. We will present a few awards at each of the 3 partnership sessions, and we will share a little bit about the award recipient, and then they'll have a couple of minutes to share some remarks, and then we'll take a virtual handshake photo as well. So without further ado, we will dive into our first award. These are Title V Lifetime Achievement Awards that recognize a lifetime of contributions to MCH populations, public health, and the Title V mission. And our first recipient of the Lifetime Achievement Award is Dr. Arden Handler. Dr. Handler is the Director of the Center of Excellence in Maternal and Child Health and a professor in the Community Health Sciences Division of the University of Illinois Chicago School of Public Health. Dr. Handler's research career reflects her longstanding commitment to reducing disparities and improving the health of women, children, and families. Her specific interest is the exploration of factors that increase the risk for disparities in adverse pregnancy outcomes and examining ways in which the healthcare delivery system, particularly how prenatal care, postpartum care, and well woman care, can ameliorate these risks and reduce disparities and inequities. Other research and teaching interests include maternal and child health advocacy and policy, building analytic capacity of the MCH workforce, and the structure and functioning of the public health delivery system. Dr. Handler is a former member of the Secretary's Advisory Committee on Infant Mortality, and she's a nationally renowned leader in maternal and child health advocacy, policy, epidemiology, and public health system improvement. She has made it her life mission to improve MCH outcomes and support Title V programs in the United States, especially within the state of Illinois. Her passion is to educate the current and emerging Title V workforce to ensure that Title V will not only sustain, but thrive. She approaches all her MCH work with a sincere acknowledgement and respect for the current and former MCH leaders, as well as MCH history. It's my pleasure to present the Lifetime Achievement Award to Dr. Arden Handler.
Can you see me? Okay.
Not yet, we can hear you.
Okay, I'm in a corner. I'm not like on the main screen.
There you are.
Okay, so thank you so much, Dr. Warren and other members of the MCH community for selecting me to receive the 2021 Title V Lifetime Achievement Award. And thanks to my former student and now colleague, Christine Bozlak, for nominating me for this prestigious award. Beyond my absolute delight in receiving such an award, receiving a Lifetime Achievement Award focused on Title V is especially thrilling, as I consider Title V and the Maternal and Child Health Bureau my professional home. In thinking about my achievements over the past decades, I want to take a moment to reflect a bit on my career and all those I have met, interacted, and collaborated with along the way. So it'll just be an extra minute. My MCH journey began in the Maternal and Child Health Department of the University of North Carolina, where I had the privilege as a Maternal and Child Health Bureau funded trainee to learn from the likes of C. Arden Miller, had the good fortune to be assigned to Jonathan Koch as his first MPH advisee, and had the opportunity to make lifelong friends and forever MCH colleagues such as Kay Johnson, who's also being honored here today as well, Amy Fine, and Kathy Johnson. Next, I was off to the Gary Health Department, where as a young MPH graduate, totally hooked on the field, I had the amazing opportunity to be hired to administer Indiana's Improved Pregnancy Outcome or IPO program. For those of you in the know, as a young MCHer having my very own Title V program of projects to run, I couldn't have been more excited. Indiana was the last state to get an IPO. It's not that often that a 25-year-old gets to sink their teeth into one of the very projects she's just finished learning about in her MPH. It was an incredible experience, despite the frustration of working in an underfunded small health department and trying to implement a universal prenatal care program for all of Lake County, Indiana. After Gary, I once again became an MCHB funded trainee, this time at the University of Illinois School of Public Health under the tutelage of the wonderful Dr. Naomi Morris. When I graduated with the DRPH in 1987, I joined UIC SPH, where my career continues today as a faculty member and leader of multiple MCHB funded training programs. In my almost 35 years at UIC, I've built a career dedicated to two ideas: eliminating racial and economic inequities in maternal and infant health in particular through research, policy, and advocacy, and building and developing the MCH workforce, particularly one in which trainees see themselves as part of the long, righteous history of maternal and child health in the US and understand that they are part of a living, thriving, passionate, committed MCH community. Along the way, I've worked with many amazing individuals and colleagues. Please forgive me if I did not mention your name. First, I want to thank all of my UIC MCH colleagues with a major shout out to Deb Rosenberg, Kristen Rank, Joan Kennelly, and Barney Turnock, as well as my MCH friends and collaborators across the MCH, Holly Grayson, Milt Kotelchuk, Sherry Pies, Lois McCloskey, Cynthia Minkovitz, Donna Stravino, Anita Margolis, and my many partners at CDPH, IDPH, City Match, AmChip, the SACM, with a special shout out to Art James, the National MCH Workforce Development Center, and the MCH Navigator. Finally, in terms of thanks, of course, I have to thank my family, my parents who never put any limitations on my trying to change the world, and my husband, Rob, and children, Evan and Miara, who have put up with the 30+ years of me being a complete workaholic. So as I reflect back on my lifetime achievement, I don't think of the many presentations, manuscripts, trainings, evaluations, reports, tools, toolkits I've developed or collaborated on, but rather I think of the following, and Milt, you'll get a kick out of this. Milt Kotelchuk and I are walking from a hotel to a restaurant for dinner with many of the UIC MCH EPI graduates who have come to an annual MCH EPI conference from all over the country. Deb and Kristen and I always hosted this dinner when we were at MCH EPI conferences, and Milt always joined us. Let's just say he was a regular. Milt and I were walking ahead, and about 10 of my former UIC MCH EPI students were following behind. At that moment, I had this image of a mother duck being followed by her ducklings, and I said to Milt, "You may have the cattle truck industry as your legacy, but I have all these amazing committed MCH professionals as my legacy, working in leadership positions across Chicago, Illinois, and the nation." And I have to say, it just doesn't get better than that. So again, thanks to MCHB and to all of my family, my friends, my colleagues who joined me on Zoom today. I see there's lots of you there, and all those congratulations. I appreciate it. I truly appreciate this recognition for what I believe has been a career very well spent. So thank you, and thanks, Mike, for giving me this award. I don't know if I'm supposed to hold this up now. Can you see it? I'm on.
We can, although with the blur, I think.
Yeah, I can turn the blur off. My husband said blur on.
We want to make sure. We want to make sure to see your face.
Yeah.
There you go.
All right, hold on.
Maybe hold your award just a little bit to the side so it's not covering your face.
Okay, I'm just going to try to get the, all right, I'm on none now. Okay, there we go. Let's see. Can you see it? It's a little hard to see because it's clear.
Still blurred.
Still blurred. Okay. All right, I tried to get it on,
There we go.
There you go. Okay. Should be none now. Okay.
All right.
Perfect. Okay, hold on one sec. Okay, got it. Thank you.
All right. Thank you.
Thank you. Congratulations. Next, we would like to recognize, continuing with the Lifetime Achievement Awards, Kay Johnson. Kay has spent nearly 40 years in maternal and child health policy on top of her early career in direct service in early care and education, as well as run a small woman-owned S corporation, Johnson Group Consulting. Kay is nationally recognized for her work in maternal and child health as an advocate, researcher, and consultant. Reducing the impact of poverty and racism and increasing access for women and children are two of her lifelong goals. Her expertise encompasses a wide range of issues, and her work at the Children's Defense Fund, March of Dimes, George Washington University, and Johnson Group helped to shape the direction of MCH and Medicaid policy since 1984. From 1984 to 1997, she worked in Washington as an advocate, lobbying, and policy leader on MCH issues, including substantial involvement in 6 successive Medicaid expansions, major amendments to Title V, creation of the Vaccines for Children program, creation of the Children's Health Insurance program, and health reform. She's held several HRSA contracts from 1998 to 2021 on various MCHB priorities, including newborn screening and genetics issues, Title V transformation, child health and EPSDT, Healthy Start, infant mortality coin, MCH measurement, social determinants of health, and health equity. Early in the Obama administration, Kay served as senior advisor to Dr. Liu under an IPA from Dartmouth, and throughout this time served as chair of the Secretary's Advisory Committee on Infant Mortality. Her capstone was working on the environmental scan and goals development for the new MCHB Strategic Plan. During the years of Johnson Group, she has also had contracts with CDC, various states, and many foundation-funded projects. It's my pleasure to present the MCHB Title V Lifetime Achievement Award to Kay Johnson.
Thank you so much, Dr. Warren. It's really, I thank you so much for the honor of a Title V Lifetime Achievement Award. And while it's difficult for me to feel deserving, I'm really deeply touched by this recognition. I reflect on what it means to come from being born to a mother who migrated from the Ozarks to raise her children on a poverty level waitress wages in the Rust Belt. And I wish that she and my sisters could be here with me in this moment today. You've talked about my commitment to reducing poverty and racism over the past 38 years. I want to tell a couple of little pieces. When I was an early childhood educator in 1979, my friends Dr. Arden Handler, just honored, and Amy Fine suggested that my passion for improving the well-being of women and children made me an MCHer. I did not know what that was, but they were right. So I enrolled in public health school with the support from an MCHB funded training grant where Dr. C. Arden Miller, Dot Brown, and others at UNC grounded me in Title V. My goal was to work with the Children's Defense Fund, and my dream came true. In 1984, the first task assigned to me by my mentor, Sarah Rosenbaum, was to conduct a survey of state Title V agencies about the impact of Reagan-era cuts and the block grant transition. My work on Title V policy continued through 2021. You've listed very nicely my jobs and my contributions across policy areas, but I would like to remind you, as what I've told you before, that working on the design of the new MCHB Strategic Plan was a capstone for my career. I had the honor to work formally and informally advising 5 MCH directors: Hutchins, Nora, Van Dyke, Lou, and you. I've worked for and with every division of MCHB, and I engaged with Title V agencies in every state except Idaho. I don't know why they don't like me. Over 22 years, as you mentioned, I held contracts and subcontracts. They were often guided by Jamie Resnick as my insider term, core. And I just want to mention a couple of project officers without whom it wouldn't have been possible: Michelle Puryear, Mary Beth Badura, Johanny Ascarni, David Heppel, Phyllis Stubbs-Wynn, Reem Gandor, Hani Atrash, Deborah Wagler, Vanessa Lee, David Willis, Sylvia Sosa, Michelle Lawler, and Amanda Innes, and that's in chronological order. I am grateful and thankful to the thousands of public and private MCH leaders who inform my work across a lifetime. While there is so much more to do, together we've had successes and impact on the health and well-being of hundreds of millions. I did some math. I'm not exaggerating. It is hundreds of millions of women, children, and families. I'm so honored. Thank you so much. Let's see how I can do on holding up. Tough to do, but there it is.
Perfect. One sec. Okay, I got it. Thank you.
Thank you. Congratulations, Kay. All right. Next, I'd like to recognize Kathy Karstein with a Lifetime Achievement Award. Kathy Karstein has dedicated her career of nearly 4 decades to improving the lives and opportunities of women, children, and families. As a public health nurse leader, she has served in local communities, state health, and internationally. Some of her roles have included being staff nurse in a rural public health clinic in Colorado, a Peace Corps volunteer nurse and teacher in the Solomon Islands, Peace Corps staff in West Africa, state school nurse consultant and school health program manager for the Nebraska Department of Health and Human Services, and program manager for the Maternal Child Adolescent School Health Program in the Nebraska Division of Public Health for the past 10 years. Ms. Karstein is a longtime champion of equity, employing a commanding use of a health equity lens in any of the MCH projects she leads, including initiating and leading for 5 years the Nebraska Cross-Sector, Cross-Division Health Equity Collective Impact Group. She lends leadership to workforce development activities involving Nebraska's community health workers, often in groundbreaking and foundational ways. Most recently, she and her colleagues are launching an activity entitled Disrupting Maternal Disparities. Ms. Karstein demonstrates leadership in many forms by leading and mentoring teammates, colleagues, and students, training health professionals, advocating for and ensuring purposeful engagement of all stakeholder groups, and proposing innovative strategies to address Nebraska's MCH priorities. She inspires with her vision of a world where all children are valued and protected, resources and opportunities are distributed equitably, and all families succeed. It's my pleasure to present the Lifetime Achievement Award to Kathy Karstein.
Good afternoon, everyone. Dr. Warren, thank you. Thank you, everyone, for the honor of this wonderful award. My remarks will be very brief and forward-looking. I have long been passionate about our work together, lifting up the lives and well-being of women, children, and families in America. Yet today, as I think you know, the need seems more urgent and greater than ever before. As MCH professionals, we will bear witness to the life course consequences of disrupted and dismantled social determinants of health for millions of households. We are measuring the additional and disproportionate burdens of adversity being piled on children, families, and mothers in the form of disrupted routines, lost education, stress, anxiety, isolation, material insecurities, and trauma. And we know that racism and hate harm every child and diminish the future for all of us. As MCH professionals, we are uniquely equipped to describe and address the significance of these matters. But we must be willing and courageous enough to do our work differently in order to achieve more fair and equitable results for all families, especially the most disadvantaged among us. MCH professionals are entrusted to carry the most vital and life-affirming of leadership messages for our country. That the well-being of families, all families, must be first and foremost, before corporations, before politics. While the remainder of my career may be counted at this point in years rather than decades, I continue to be propelled forward by the same two questions that have energized me from the start of my career and which I commend to you now. Who are we in this moment facing these challenges? And what's next? Thank you and best wishes to you all.
Thank you so much, Kathy, and congratulations. We'll pause a moment for a photo.
Okay, perfect. Thanks.
Thank you.
Right. And our final award for today, a Lifetime Achievement Award, goes to Anna Novaish. Anna is a tireless champion of maternal health in Rhode Island and the nation. She's worked for the Rhode Island Department of Health from 1998 to early 2021, first as an education and outreach coordinator focusing on child health issues, then as chief for the Office of Minority Health, Title V Maternal and Child Health Director, Division Director for Community, Family Health and Equity, and finally, the Executive Director of Health. As her positions increased in scope and responsibility, she consistently incorporated authentic community engagement with a goal of racial equity. Mrs. Novaish currently serves as the Assistant Secretary of Rhode Island's Executive Office of Health and Human Services, where she aligns the combined power of key agencies that are impacting people's life outcomes. She has received national acclaim for the development and implementation of the Rhode Island Health Equity Framework as a plan of action for achieving health equity at the state and local level through the Health Equity Zones Initiative. This model is being replicated by other states supported by the Robert Wood Johnson Foundation. It's my pleasure to present Title V Lifetime Achievement Award to Anna Novaish.
Thank you so much, Michael. I am humbled. I appreciate. And to be honest, when I got the letter, I like, I don't know why I'm getting the award. And when I see the prestigious company that I am today, I still ask that same question. But I appreciate and I thank you. I think as I look back, it's indeed a long time. It's a long career. I turned 60 this year, this past year. So I'm going to be 61 this year. And I measure my career years, in fact, by my daughter's age. I started my career in public health when she was born. And it's been marked my career by my children as they grew. I knew what was maternal health. As they became adolescents, they taught me the challenges that we needed to address from a policy and programmatic perspective with adolescent health. And as they become young adults, they also taught me how we needed to think about transitions from adolescent to adulthood and how we all circle back. But also my career has been defined by where I come from. You know, by my name, you know, by my accent. I was born SK, not in the United States. I was born in Cape Verde Islands from a Portuguese mother and from a father from Angola. I came as an adult to the United States, and the dreams that I had for myself, I've never thought I would accomplish them. But here I am today, having achieved my career and all of those experience early that I had in Cape Verde, one of the poorest countries of the world, having then the same conversations in the United States in terms of addressing determinants of health, in terms of most vulnerable population not being listened to, in terms of not investing in our communities. How could we have a United States of America where we have people who go hungry, where we have kids who are not having an education that is well deserving, when we have so many resources? And so when I think about those challenges, and I think about where we are today and the past year, I look forward and I look to the years to come, because we have this unique opportunity upon us to really change that narrative and to finally make it a reality. We are powerful, we are creative, we are innovative, we have skills, and we have commitment, and we have passion that indeed can make a difference. So thank you for recognizing me and everybody else. Thank you to my friends at the Department of Health that made possible the career that I have, to my friends at MCHB, to my colleagues at CityMatch, the staff, amazing staff and board that I had the honor to chair, and to all of the folks that throughout my career had helped me be who I am today and where I am today. And a special thanks definitely to my family, to my husband, my kids who are here today, and my parents that always said that we could do whatever we wanted to do. So thank you, Michael. You've been part of that journey with many others. And so thank you so much. And I look forward to the work ahead of us.
Thank you so much, Anna.
I do have my award.
Wonderful. Congratulations. We'll grab a quick photo.
Perfect.
Thank you.
Thank you. So good to get to spend some time with all four of our winners today. I want to thank them for their tremendous contributions to the field, for their mentorship of many of us on the call today, and for their continued service and inspiration. We'll be recognizing additional winners at each of the remaining partnership sessions, both MCHB Director Awards as well as the Vince Hutchin Partnership Award. And so please stay tuned for those at the conclusion of the remaining partnership meetings. I also just want to point out one of the things that is great about doing these sessions virtually is that our award winners can feel the love in the chat. And so I hope you will take a moment to recognize the accolades and hugs and high fives and well wishes that are coming in for all of you from across the country and from your colleagues and work family that love you and think so much of you. So thank you all. Congratulations. Thanks for the great session today. And with that, I will turn it back over to our colleagues at MCHB.
Thank you for a wonderful, wonderful day. That concludes our session. The next sessions will be held March the 31st and then April the 28th. Congratulations, everyone. Take care.
Thanks, everybody. We'll follow up with the recording and slides and other materials.